Many of us enjoy a drink, and so we're going to talk now about alcohol in the low-carb diet. There is actually a spectrum of how sugary alcoholic drinks are. They go all the way from something that's obviously sugary like a cocktail or a Baileys, but also beer, is, my son calls it liquid toast. There's a lot of carbohydrate in beer. Then at the other end of the spectrum are very low carbohydrate alcoholic drinks. That would be something like neat gin or vodka. And then slightly more sugary might be red wine, and then dry white wine. And so the spectrum goes up all the way from a neat gin or other shorts to the sugary drinks and beer. But something just to bear in mind is alcohol isn't really very good for somebody with type 2 diabetes for other more complex reasons. And so we need to keep it away from being a daily thing. Alcohol, like many other things that we enjoy, is a treat, and to be something that we have maybe just a few times a week. I was mentioning that the shorts on the whole are low carbohydrate, but of course many of us add mixers. That would be something like tonic water or ginger beer, I don't know. But bear in mind, you must look at the mixers also in terms of the carbohydrate content. And this brings me to another subject, which is some of the mixers are low calorie, low carb, but have sweeteners in. And unfortunately, for some of us, that tends to add to your appetite. So experiment. Does that affect your appetite or not? Maybe it doesn't, in which case that's fine. But if you're having mixers and then you're feeling hungry again, that might be the problem. And you might have been better just having that whiskey, maybe with some ice cubes, without the mixer. For myself, I tend to only drink a couple of times a week. And if I am drinking, I tend to keep it just to a short, in my own case, with some ice cubes or maybe red wine.